Okay, Dr. Amenorrhea, you can start.
Okay. Hello.
Hello?
Am I talk to Mr. Mrs. Jacqueline Ford, 32 years old?
Yes, I'm Jacqueline. Yes.
Okay. I'm Dr. Menazir, one of the doctors in the clinic today. Nice to meet you.
Thank you. Nice to meet you, doctor.
Okay. So I will ask you some questions in our conversation today. Is it okay with you?
Yes.
Okay. Can you tell? I received a letter from your GP stating that you have problem in your cycle. Can you tell me, please, more about that?
Okay, doctor. So for the last 7 months, I'm having disturbance in my cycle. It's not as before. Before, I used to have my cycle every 3 weeks, sometimes every 4 weeks. Yes, sometimes after 5 weeks. But now, for the last 7 months, no cycle at all.
No cycle at all.
Yeah.
So this is first time.
Yes, doctor. This is the first time for me to happen.
Okay, since 7 months. Okay. It is irregular or no cycle at all, as you say?
Before the 7 months, it was a little bit irregular. Then after this, it's complete cessation. Stop it completely.
Okay. So is there any problem associated with your disturbance of cycle?
Problem?
Any
Like
association?
what? Like
Any
what?
problem like any symptom of increase or decrease your weight or weather intolerance or any symptom associated with just absent cycle?
No, doctor, nothing from this at all. I don't feel anything from this.
So you have received any medical advice before?
Medical? No, I didn't seek any medical advice. Never.
Okay. So I will ask you, you have any problem in your water work, in any discharge like that? Any abnormal discharge, any abnormal symptom in private area?
Don't ask 2 questions at the same time, doctor. Only 1 question. Yes. What do you want?
Okay. So you have any other problem in your private area like abnormal discharge or abnormal odor?
No, doctor, I don't have like this.
Any abdominal symptom? You have tummy pain or vomiting?
I don't have tummy pain. No.
Okay. Okay. Have you any symptom of shortness of breathing, palpitation, symptom like that?
Shortness of breath or palpitation?
Yes.
No, doctor, I don't
Yes.
have anything from this.
Okay. Any chest pain, any cough?
No, no chest pain, no cough.
No headache?
Headache?
Yes.
No, I don't have headache, no.
Okay. Visual problem?
Visual problems? No.
Okay. So you have any? We will return again to your your symptom from the start. So with irregular cycle, you are married?
Yes, doctor, I am married.
You have children, so?
Yes, I have 1 kid. He is 3-year-old now.
3 years old. Okay. So what is about your past history? Have you any history of hospitalization, previous hospitalization?
No, just for labor only.
Labor only, okay. Normal labor.
Yes, normal. It was normal.
Okay. Any surgery before?
No, doctor.
Blood transfusion?
No.
Okay. Can you tell me about your medication? You have any medication?
No, doctor, I don't receive any medications at all.
Okay. Any family history of similar condition?
No, doctor, I don't have.
Okay. So tell me about your job. What is your job? Is it stressful job or normal?
No, I'm a housewife. I don't work.
Okay. So are you smoke?
Smoking? No, doctor. Do you smoke? Do you
You,
smoke?
okay. Do you smoke?
No, I don't.
Do you drink alcohol?
No.
Okay. So is there anything if you're sweating or like that?
No. Sweating? No.
Yes, no sweating.
No.
Or high temperature.
No.
Okay. No weight changes again. Sorry.
No.
Okay. Or weather preference.
Weather preference? No, doctor.
Okay. 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 What is your expectation, Mr. Jacqueline?
I'm expecting you to admit me, doctor, because I need my cycle again. I don't know what's going on.
Okay. Okay. I highly appreciate your feeling, but I think you are not need admission today. You are need just investigation, some investigation. We'll take
Investigation?
blood test. Yes, we'll do for you blood test and imaging to look for the exact cause of this problem. Is it okay with you?
Okay, so
Okay.
doctor,
Okay. Can
yes,
I ask you? Okay, I will come back again to symptom. But can I ask you some question again,
you
if
can
you
ask
are
yes,
not mind?
yes.
Okay. Is it there is any association with your cycle disturbance? Any is it nipple discharge, something like that?
Nibble charge? No, doctor, I don't have.
Okay. Any abnormal in your private relation?
No, doctor.
Okay. So you have any concern?
Yes, doctor, I'm concerned about this stoppage of my cycle because I know one of my friends. She was at the age of 35, and then she had a problem like this, and then she went to her doctor, and then he told her that she is having premature menopause. I'm afraid,
Mm-hmm.
doctor, I don't know what's going on.
Okay. 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 This is happen premenopausal symptom or premenopausal stop of period. It is one of the possibilities. So we will do for you some investigation to exclude another secondary causes. If there is any treatable condition, we will treat and recycle will again. If no, we will discuss with you after a blood test and investigation. Is that okay with you?
Okay,
Okay.
okay.
This is my first time, Dr. Khalid. Sorry.
It's okay. So if you want us to stop here, we can stop here. It's okay. But still, you are having 2 minutes. Okay. So to save your times, Dr. Manazil, she will stop here. Okay, Doctor, we'll ask some questions. So, Doctor, now the examiner will ask you, what's your differential diagnosis, Doctor?
My differential is in the chronology problem. First, top of my differential premenopausal, because no, in just brief history, I didn't search, I didn't know any underlying cause.
She is a female, yes, Doctor.
Premenopausal.
She is pregnant, or you don't know?
So I don't ask.
Okay. Do you think that this is important to ask here about pregnancy?
Absolutely, yes.
Okay. What about her past? What about her past history?
Past medical history?
Yeah.
I asked her from medication. She tell no medication at all. Previous hospitalization.
She has a past history of chronic diseases.
Oh, yes.
Yes. What the chronic disease?
I forget to ask from chronic disease, especially.
Okay, Doctor.
Specifically.
So what about her? So how is her mood? You know, this lady told you that she is annoyed about her amenorrhea. She wants her cycle to come back again. So what about her mood? She is depressed or what?
Yes. I don't ask. But I didn't ask from her moods. It's very important.
Okay. So she's using any recreational drugs or herbal medicine?
Yes, also I didn't ask.
Okay. Thank you, Doctor. Okay. For the first time, this is good, by the way. Don't worry. All of us learn each day, we learn. But please, doctors, keep again. I will keep saying it again many times. Please, doctors who didn't attend with us previous sessions, please, doctor, you will receive a blank paper outside in station 4, in station 2, and in station 5. You will receive a blank paper outside. Outside, you should divide it like this, because you will be mentally blocked inside the station. Why? You are studying for the last 6 months, 4 months, 1 year, preparing for the basis. You paid so much money, you attended so many courses, online courses, clinical courses, and then you traveled away from a country to another country, and you don't know the people. You are struggling with the accent of the people you are dealing with, and you didn't sleep all over the night, okay, and you didn't even eat your breakfast, so you are under huge stress. You will forget things inside. So please write so as not to miss anything. Please divide the paper outside like this, in station 4 and even in station 5, sorry, in station 2 or even in station 5. Divide it like this. Here we will write differential diagnosis of the case. Here write the CRB first, then WT. Here write your positive data. And here write the ICE plus management. I is for impact and ideas, C for concern, E for expectations, and then the management plan, whether pharmacological or non-pharmacological treatment. So what we will do here, doctors, I don't want you to be annoyed, Dr. Manazir. It's okay, don't worry. But
yes,
here, yes, don't worry. So, from 1 second, please, doctor.
It's my first time.
Assalamualaikum. Sorry, Dr. I'm with you. Okay. So we said we will divide the paper outside, and you will take this paper inside with us, and you will read from this paper inside. Don't worry. What will you do up here? You write here the patient's name. Please, doctor. Please, doctor. Don't practice any clinical session or on Zoom session without changing the name of the patient, because I will tell you a very fatal mistake. One of the doctors in one of the courses, when you attend with her or him or she says, for example, the patient's name is X. You know what will happen, doctor? Inside the exam station, you will tell the patient, you will know the patient's name, for example, Mr. Abraham. You will keep telling him, okay, Mr. Abraham, see Mr. Abraham, and then by the middle, when you go deep in stress, you will tell him, okay, Mr. X. So please try to change the name every time. If you attended with me, the doctors who attended with us the previous sessions will see that I'm changing the name every other time, because it will stuck in your mind that the name of the patient inside the station is Mr. X. So again, what will you write here? You write the patient's name and the age, and then write everything like this, and read from this paper inside. We will come to the differential diagnosis. Doctor, what is the CRP fast? C for complaint, and how can we analyze any complaint? Any complaint should be analyzed in this way: onset, course, duration, associations, what increase, what decrease, effect of treatment, and the date of last attack. So we'll ask here, Mrs. Jacqueline, can you please tell me more? This problem started when? 7 months ago, doctor. Okay, so you are talking about secondary amenorrhea from the start, from the first tour. The course, as you said, it was before regular and then sudden stoppage, or it was irregular then stop? She answered. And duration the same for onset here. Associations. What are the associations, doctor? Because we as physicians, we are stuck sometimes in the associations. We don't know what are the associations. The associations, doctor, here in any analysis of any complaint will be one of two, either from the related system or from the differential diagnosis. For example, a patient came to you with chest pain. So don't ask about associations. Do you have headache? This is unlogic. But you should ask him, do you have any shortness of breath? Any palpitation, any racing of your heartbeats, any loss of consciousness? Don't ask him a headache, because this is not an association for this complaint. So be logic in mentioning an association, okay? And then, for example here, this patient is having amenorrhea. So you have to ask here about associations based on the differential diagnosis. So your association, doctor, should be based on the differential diagnosis, because you will pick up clues from here. So you have to write the differential diagnosis outside. This is very important, because inside the exam, you will write the differential diagnosis here, and then ask associations based on your differential diagnosis. And then after finishing your differential diagnosis, you can review other systems. But the problem that we say, we analyze the symptom and we forgot to ask in details about association. If we said in the onset, course, duration, blah, 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 what is the most important point that will consume time from us is the association, because it will bring the clues to you. Then what increase, what decrease? Nothing here. Effective treatment, did you receive any medication for this problem? No, doctor. And date of last attack, when the last time? Here, it's not applicable, okay? Because she already told you that the menses stopped 7 months ago. So from the associations, we can get the clues for our case. Then come to the R. This R for review of other systems. From above, now here, I'm inside the exam now. I finished the complaint. I will write tick over it. Inside the exam, don't worry. You took permission already from the patient that you will write some notes, okay? Then come to the review of other systems. Review of other systems, usually you start with the most related system if you didn't start in the association, if you forget in the association. Then what will you do to take, if you cannot take it in a differential diagnosis oriented manner, you can bring it from above down, from the neurological system down to the foods. If you went in this way, you will not be hesitated, because when you analyze a complaint, then go to the review of other system, then past history, then family history, then go back again to the asking about the complaint, they will write note in their remarks that you are hesitant, in taking history. If you forget one point and went to it back again, it will be okay. But if you forget 3, 4, 5 points in the main complaint and then went back after asking about allergy and family history and blah blah blah, they will put you hesitant. The other thing, after asking the patient concern, you shouldn't go back and ask again about the previous complaint, because in the exam they are expecting you to pick up the diagnosis from the first line. They are expecting like this: 60 cases of the history in your life, you will get it from here, from the first line doctors. Even in your life, in the medicine, you will pick 60 or 70% of the cases from the first line if you did it well. Then review of other system, then past history. We said in the past history, small mnemonic, doctor, yesterday or the day before yesterday, just to remember the things. We said it, we wrote it. Any doctor can remind it. We just said it yesterday or 2 days ago. How to ask about the past history so as not to miss anything. We said systolic blood pressure, congenital heart disease. Okay. Just to remind yourself, like this doctor in the exam, don't worry before entering. So S for smoking, B for blood, sorry, S for surgery or procedures, B for blood transfusion, B for female, 3 Bs, 1, 2, 3, and C for chronic diseases, H for hospital admission, and D for drugs. And we as a physician, we said drugs for us in our mind means 3 things. What are them? Any doctor can say or can write, it's okay. What's meant by drugs? Equal 3 things in paces. You will not tell the surrogate that what are the drugs you are using, because drugs means illicit drugs. Yes, medications, illicit drugs, what else? Herbal medicine.
Herbal.
Yes, so drugs for us means 3 things: medications, illicit drugs, and herbal medicine. Then come to, the B. B for a female. If the case is female, any female, you should ask about 3 Bs. If you did not ask about the 3 Bs, you may miss. So you may miss the station. So is it pregnancy, pills, and periods? For sure you didn't ask about pregnancy, they will not forgive you, because this as a female came with amenorrhea. Pills, you asked already about pills. Periods, she came already with amenorrhea. If she is having, if she told you I'm having period disturbance or cycle disturbance, so is it irregular, regular, increase in amount, decrease in amount, or what do you mean by this? Okay, so you can talk here, but make it 3 Bs to make it easy. Pregnancy, birth, period. Okay. Then F, family history. Family history of similar condition, family history of chronic diseases, or family history of consanguinity if your case is suspected to be autosomal dominant or autosomal recessive condition. Then A, allergy. Allergy for any drugs, allergy for any allergy to any medications, allergy to food, no. Any atopy, I mean any asthma before, no. Then come to the social history. Doctors, please, doctors, please, don't forget the social history in any patient. Social history is extremely important for 2 things. Number 1, the clue may be inside the social history, This is number one. Number two, social history usually contains item that needs to be resolved from you. And we said the mnemonic for social history is sharp G. Sharp G. S for smoking. If he is a smoker, you should offer help. H for hobbies and housing. If she is living in high altitude, for example, he may suffer polycythemia. Okay? A for alcohol. If he is drinking alcohol, you need to help him. R again for recreational drugs. If you forget to ask about it here in the D's. So smoking, alcohol, recreational drugs here. Then B for pets. And G for job. Everyone from this needs your intervention, doctor. If you forget the social history inside the station 2, they will not forgive you. Why? Because, for example, if this patient is having joint problem, and you didn't ask him about his job or her job, and she's working as a secretary, you will fail. Why? You will not solve her problem because you didn't ask about her job. Secretary, and she's using her hands all over the day, and she's having rheumatoid hands. How can you help her? And you didn't ask about her job. So social history is extremely important. Don't miss the social history. We miss the social history, but it's extremely important. So, for example, I will ask this lady, do you smoke? Don't say, are you smoking? Do you smoke? No. That's good. When the patient says something good, say just, to be interactive with him or her. That's good. Very good. Excellent. Appreciating, like this. Then H for housing. Where do you live? I'm living in the downtown, doctor. Do you have any hobbies? Yes, doctor, I'm having a hobby. What's your hobby? I like jogging, doctor. I like jogging. I play, for example, two hours per day or 3 hours per day. So you write the positive things here down. You are taking the history. The patient is having amenorrhea or disturbance cycle for the last 7 months. Anything positive you think that it's related, write it. What else? Nothing positive from above. She is jogging every day. Okay. Then the S, sexual history. You asked about sexual history, yes, but you didn't ask about if she is having extramarital relationships or no. Mrs. Jacqueline, are you married? Yes. I'm so sorry for this, but I need to ask you a question. It's not specific for you, but usually we ask for all patients just to reach the diagnosis. Do you have any extramarital relationships? No. Stop here. Then come to the psychological history. Extremely important, doctor. Psychological history. What about your mood? I'm not a good mood. I'm in a good mood, doctor. Or I'm not in a good mood, doctor. I'm so sorry for this. What do you mean by not in a good mood? I feel depressed. Oh, I'm so sorry. Though if your patient told you in the exam he is depressed or she is depressed and you bypassed it, you will not pass. Because he is having depression, you should assess this depression because it may be severe depression, and after he comes out from your clinic, he will throw himself in the river. And then you lost your patient. Okay? So I'm so sorry for this. Can you please tell me more about this problem? And then right here in the positive data, depression. Because these things, you will need the positive data to summarize to the patient again, when you summarize the station to him again. Okay, sorry, I'm so sorry for this. Did you have any bad ideas about life and death? No, doctor. Did you try to hurt yourself before? No, doctor. This is, you are asking if she tried suicide before or no. Now you are safe that she didn't try to harm herself before. So this is mostly mild depression, and no need to refer the patient. Okay. This is very rapid screening. Then come to the T, travel history. You didn't ask her about travel history. It should be asked whether Driving, I will tell you, doctor, driving, where we should put driving. Then come to the WD, weight change, T temperature, sorry, and S for sweating. 3 related to each other. Okay, so this is the way that you will ask the history. This is the way that you will ask the history. And come to the ICE and management. ICE, this is the impact. Mrs. Jacqueline, can you please tell me more how this problem badly affect your life? Yes, doctor, it's affecting my life. I need a baby. I'm so annoyed by this. Oh, I'm so sorry for this. I will come to this. So now, right here, again, this is her concern. Sorry, this is here the impact. She wants a baby. What's your concern? Can you please tell me your concern? Yes, doctor, I'm concerned about this problem. I'm afraid of premature menopause. Then this is her concern. You should answer her concern immediately. Don't answer the concern by the management plan. For example, if a patient told you, doctor, I'm afraid I'm having a cancer, don't tell him, okay, see, we will do some tests for you, and then we will, I will do some imaging, some tests for you, and we'll talk to my consultant. We will arrange another meeting for you, and we'll tell you the results. This is bad management of the concern. If he asked you, I'm having cancer, oh, I'm so sorry for this. You know, cancer is on the possible lists, but it's not on the top of my list. However, we should do some tests to exclude. So when he asks for a concern, answer the concern directly, and then say broad lines of the management plan after this. But when he asks the concern and you told him your management plan, this is not the good way of practicing the station 2. Okay. So the expectations, what are you expecting? I'm expecting you to admit me, doctor. Okay, I appreciate your expectation, but for now, you no need to admit you, because there is nothing urgent. There is no life-threatening condition. Your problem, I hope that can be solved as an outpatient, so that we will arrange testing and imaging for you, and we'll arrange a near meeting as soon as possible with you. And then you go to the management plan. By the end of this, doctor, I want you as a physician to ask yourself 2 questions. 2 important questions in any station 2 case. The first one is, ask yourself, and you can write even here, does my patient needs admission? Does my patient need informations about driving or no? Okay, so you have to ask yourself by the end of the station, or you can write them before entering the doctor, because you will forget them inside. Okay, write them. Right, does my patient needs admission or driving information about driving or no? So no need for admission. And if anything needed for driving, you can tell the patient after this. For example, patient with epilepsy or visual disturbance, you can tell him that please don't drive, and we will arrange something to transport you to home. Okay? Okay. So again, I will run the scenario very rapidly, and then we'll come to the differential diagnosis. So Mrs. Jacqueline, when did your problem started? Or from the start? Hello, good morning. I'm Dr. Manazil. Dr. Manazil, in the beginning you said, hello, I'm talking to Mr. Jacqueline. This is not the way. The way you should tell her, who are you first? Hello, good morning. I'm Dr. Manazil, one of the medical doctors here in the clinic. Am I talking to Mrs. Jacqueline? Yes. Mrs. Jacqueline, are you 32-year-old? Yes. Nice to meet you. Nice to meet you, doctor. Mrs. Jacqueline, I received a letter from your GP saying that you are having disturbance in your cycle. Can you please tell me more about your condition? Yes, doctor. It started for the last 7 months. Before it was irregular a little bit, then it stopped completely. I don't know what's going on. Oh, I'm so sorry for this. So you told me that it started 7 months ago. Yes? Okay. Mrs. Jacqueline, is it associated with anything like from the differential diagnosis, we say like hot or cold intolerance or weather preference? No, doctor. Okay. Did you notice that there is a hair growth in your face, excessive hair growth on your face? No, doctor, I didn't notice like this. You are asking about associations now, okay? Okay, did you need to notice any nipple discharge from your, any discharge from your nipples? No, doctor, I didn't notice anything like this. Do you have any visual problem? No, asking about acromegaly. The previous one asking about prolactinoma, okay? Then even you can ask here about pregnancy, you know, because it's one of the differential diagnosis. So in the associations, ask about the manifestations of association. Okay, so Mrs. Jacqueline, did you notice that, did you receive any medication for this problem? No, doctor, I did not. Okay, then go to the review of other of the systems from above down. Do you have any headache? No. Loss of, until here, I'll just ask you rapid questions, yes or no question, if it is okay with you. And please don't ask two questions with each other. Don't say here, did you have any visual problem, loss of consciousness, headache? This is not good. Ask it, do you have any visual problem? No. Any weight, any headache? No. Loss of consciousness? No. Any weakness at any area of your body? No. Do you have any lumps or bumps in your neck? No. Do you have any problem? Do you have any problem? Do you have any chest pain? No. Any shortness of breath? No. Any raising of your heartbeats? No. Then go down a little bit. Do you have any skin rash? No. Any joints problem? No. Any rash in sun exposed area? No. Do you have any tummy pain? No. Any flanks pain? No. Any frothy urine? No. Okay. Then like this. Then go to the rapidly to the past history. Then Mrs. Are you smoking? Can I, sorry. Then go to the past history. The past history. Then ask here. Do you have any past history of surgery? No. Blood transfusion? No. Did you receive any pills? No. Are you pregnant? No, I'm not. Okay, Mrs. Jacqueline. Do you have any past history of chronic disease? No, doctor. Any medications? No. Any illicit drugs? No. Any herbal medicine? No. Family history. Do you have any family history of similar problem? No. Family history of chronic diseases? No. Do you have any allergy? And all over, doctor, you are asking, right, tick, okay? To remind yourself, you have any allergy? No, doctor. To any allergy to medication, to food? No, I don't have. Okay. And then, do you smoke? No, doctor, I don't smoke. Where do you live? I'm living with my husband in my home, doctor. Do you have any hobbies? Yes, doctor, I'm jogging. I'm jogging for 3 years, for 3 hours per day. Okay. Do you drink alcohol? No. Then, do you have any pets? No. What's your job? I'm a housewife. I don't work. Then, can you please, I just want you to ask you told me you are married. Yes, I'm sorry to ask you, this is a private question. Do you have any extramarital relationships? No. And here, by the way, in the sexual history, applicable to ask about HIV. So you can ask about any shared needles? No. Any tattooing? No. Then ask about travel history. There is any travel history, recent travel history, especially in the previous months? No, doctor. Do you have any weight loss? No. Any temperature, change in temperature? No. Any smoking, any sweating, excessive sweating? No, doctor, I don't have. So you write your data here. Okay, so Mrs. Jenny, see what I will say, doctor? This phrase is very extremely important. So Mrs. Jenny, can you please, I will just summarize the things to you now. So you came with disturbance of your cycle for the last 7 months. It was before the 7 months, it was irregular, and now for the last 7 months, it is completely stopped. Yes? Yes, doctor. And you told me that you are jogging. Sorry, I forgot to ask about social history. Sorry, psychological history. I think I put psychological history here, and we talked about it already. Okay, and you told. So I will summarize the thing for you, Mrs. Jenny. Before the concern, you should summarize. I will tell you why. Before the concern, you should summarize. So you told me that for the last 7 months you are having a disturbance of the cycle, and now it's completely stopped for the last 7 months. Yes. Yes, doctor. And you told me that you are jogging for about 3 hours per day. Yes, doctor. And you are annoyed. Sorry. Okay, Mrs. Jane. Did I forget to ask about anything Like what, doctor? Like, for example, do you want to add any other problem I did not ask about? See, doctor, this is very important phrase, because at this point, the patient can tell you, yes, doctor, I forget you that I am having, I'm lost my weight, or I'm having, if you forget anything, shortness of breath or chest pain. So the patient will remind you, even if you forgot, just with this question, can you please tell me, did I forget to ask about anything, or there is any symptom you want to add and I didn't ask about? Oh, doctor, yes, I remembered. So this is very important phrase. You should say it before asking about the concern, because once you ask it about the concern, you have to answer the concern. And if you asked him after the concern about a symptom, and the symptom appeared, it may change the complete plan for you, and then it will hit the station completely. Okay, and in your mind, no need for admission and no need for driving. So the next, okay, doctor, it's clear now how to manage the history case. It's very important to reach the history case in this way. Then we will go to the next slide, which is the differential diagnosis. This is the easiest part, by the way, or the most easy part, the differential diagnosis of amenorrhea. Amenorrhea, doctors, may be primary amenorrhea or secondary amenorrhea. Primary amenorrhea, all of us know what's meant by amenorrhea, no cycles. But secondary amenorrhea means that more than or equal to 6 months stoppage of the cycle. What is the most common cause of secondary amenorrhea worldwide? What is the most common cause, doctors? You can write.
Pregnancy.
Pregnancy. This is the most common cause of secondary amenorrhea, and you didn't ask about it. You know, even if you picked the diagnosis, the station may have big question mark, even if you reach the diagnosis, because this you forgot the most common cause of amenorrhea. So what are the causes of primary amenorrhea? You will not be asked about the primary amenorrhea, because sorry, cat. I'm so sorry. It's called cat. The cause. Yeah, the examiner may ask you very rapidly. What are the causes of primary amenorrhea? Cat. You know, cat. Cat. Congenital adrenal hyperplasia. C. A. Androgen insensitivity syndrome, and T. Turner syndrome. And by the way, you may find the case in the exam amenorrhea, and you find that it's Turner syndrome. It can come to you as a station 5, and he will bring the case for you as a station 5 amenorrhea, not for amenorrhea, no, but to examine the heart. Because what is the disease which is associated with Turner syndrome? The most common. The cardiac, I mean the cardiac.
Aortic coarctation. Aortic coarctation.
Coarctation, yes. So, aortic coarctation and bicuspid aortic valve. Bicuspid aortic valve. Sorry, what it is? Aortic valve. Bicuspid aortic valve happens with Turner. Okay, this is the most common. And then aortic coarctation. But the most common is bicuspid aortic valve. Okay, and there is increased risk of lymphoma with those patients. Okay, so expect that the examiner can ask you what the malignancy associated with Turner syndrome, lymphoma. And by the way, inshallah, we will talk about the Turner syndrome and how to approach a case of short stature. Then it's associated also with some autoimmune disorders like thyroiditis. So CAT for primary amenorrhea, congenital adrenal hyperplasia, androgen insensitivity syndrome, and the Turner syndrome. Come to the causes of secondary amenorrhea. Tuba. These are the causes of secondary amenorrhea, doctors. So the patient from the start told you that I'm having amenorrhea for the last 7 months. Now, if you want, in a mind-mapped way, everything will be very easy, inshallah. Then come to the T. T for thyroid problems. Thyroid problems can cause amenorrhea. Hyperthyroidism can cause amenorrhea, and the hypothyroidism can cause amenorrhea. Hyperthyroidism causes amenorrhea mainly, and hypothyroidism causes menorrhagia, but sometimes it can cause amenorrhea. So when you are talking about thyroid problem, hyperthyroidism decreases the menses, and hypothyroidism increases the amount of the menses, but sometimes can lead to amenorrhea. Okay, then you should ask about the thyroid with the screening question. Do you have any racing of your heartbeats, any excessive sweating? No. Do you have any weather intolerance, hot or cold? No, doctor. And if you found anything from this positive, go deeply. So it can come also as a station 5 here. So you can bring a case for you, hyperthyroidism with amenorrhea. And then what will happen? You need to examine the thyroid gland, because he brought the case to you to examine the thyroid gland. Okay, so please be brilliant here. Patient came with thyroid, with primary amenorrhea from the first look. He looks to be hyperthyroid. I need to check the thyroid gland. And if this case came to you at the station 5, the only things that you will examine in a case of amenorrhea is the visual field, and the thyroid. So if you encounter the case of amenorrhea in the exam, I mean secondary amenorrhea, you will examine 2 things only, nothing more than this: thyroid gland and visual field. Then come to O, others. Doctors, you can rearrange the mnemonic as you want, but these are the words. Okay, O, others. Number 1, exercise induced. Exercise induced. You know, doctor, females who are doing intense exercises, not usual exercises, intense exercises, they are having secondary amenorrhea. And there is a triad called female athlete triad. Female athlete triad. Those females who are doing intense exercises have amenorrhea, and they have also decreased energy. And the third was, I forgot, sorry. So there is a triad called the female athlete triad. I cannot remember the third one. They have amenorrhea and they have decreased energy. Yes, and the third one is the weight loss, or the bone loss, osteoporosis. Those females are doing intense exercises. She is jogging for 3 hours per day or 2 hours. This is intense exercise. So exercise, stress induced, or weight loss in related amenorrhea. Females with severe name, it's called female athlete triad. Female athlete triad. Allah Akbar. Okay, so the next is B. B for, sorry doctors, I told you till now that there are 2 things you will examine. I will tell you what else you will examine here. B for prolactinoma plus acromegaly. Acromegaly can cause amenorrhea. It can compress the posterior pituitary gland, causing more prolactin to come out. And B for drugs like phenothiazines, haloperidol, metoclopramide. Okay, and for sure pregnancy, and for sure breastfeeding. Don't forget this, doctor. Very important to ask about pregnancy and breastfeeding. Okay, and treatment of prolactinoma is what, doctors? How to treat prolactinoma? You can write in the chat box. How to treat prolactinoma with visual field defect? How to treat prolactinoma with visual field defect? No surgery, Dr. Aperia. Even if there is visual field defect, bromocriptine or cabergoline. I mean medical treatment, but one of them is preferred. I think it was cabergoline. So even if you forget, tell him medical treatment. He wants to listen to hear this word, medical treatment, even if there is visual field defect, no surgery. Okay, Then come to the A, TOBA. A for autoimmune hepatitis. Very important. It causes amenorrhea. So female with autoimmune hepatitis come with, she is a middle-aged female with amenorrhea, non-specific symptoms like nausea, vomiting, anorexia, like we can write it, nausea, vomiting, anorexia, headache, malaise, what else? Weight loss, right upper quadrant pain, plus jaundice if there is. Okay? So these are the causes of secondary amenorrhea. TOBA, very easy, thyroid, others, prolactin, high prolactin, drugs, medications, I mean, like phenothiazines, pregnancy, breastfeeding, autoimmune hepatitis. So if you encounter the case of amenorrhea inside the exam, everything will be easy. For the last, primary or secondary, we are talking about TOBA. Do you have any weather preference? No. Do you practice intense exercises? Yes, doctor. So put it in your mind and you can write it down. This is a differential diagnosis, doctor, or are the associations. After asking about associations or differential diagnosis, review other systems. Okay? Then, how is your life? Is it stress? I know that all life is filled with stress, but you think that your life is very stressful? No, doctor, it's not like this. Did you lose? Are you losing your weight now? No, doctor. Okay. Did you notice any nipple discharge or decrease in the, oh, sorry, yes, doctor, for the last one, I forgot to write it here. Yes, PCO, thank you for reminding. PCO, how did I forget it? Thank you very much. PCO, and we said in analyzing of the symptom, polycystic ovary, did you notice any facial hair? No. Any obesity, any increase in the weight? No. Do you have any diabetes? You are asking about insulin resistance. Okay, so don't forget these ones. P for prolactinoma. A, acromegaly. Did you notice any change in the size of your hat or your ring or your shoes? No. Did you notice any problem in your vision? I mean the size of your vision? No, doctor. You are asking about acromegaly. Then, are you pregnant? No. Are you breastfeeding? Feeder? No. And then ask about autoimmune hepatitis. Do you have any tummy pain? No. Any discoloration? No. Any nausea, vomiting like this? No. Then come to the point. So Mrs. Kelly or Mrs. Jacqueline, now to wrap the things, you are having this disturbance in the cycle for the last 7 months, yes? And you told me that you are jogging for the last jogging and doing intense exercises, yes? Yes. Is there anything you want to add? No, doctor, thank you. Okay, Mrs. Jacqueline, I'm suspecting that you are having a condition. Sorry, I'm suspecting that the cause of this, I'm suspecting, after asking her about concern, she will ask you, I need BIV, I need my cycle. Okay, see, we will try to solve this issue. But I think that this is related to your intense exercises. For now, I encourage you to decrease. I will not tell you stop, but at least decrease the intensity of your exercises for the next 1 year. For sure, we will do some tests for you, including the differential diagnosis causes, doctor, okay, including blood tests and the imaging. And then to the examiner, tell him that I need to examine this patient if this is not a station 5, okay, and I need to do thyroid functions for here to make sure that there is nothing. I need to do to take her height and weight to measure her body mass index because it may be weight loss related. I need to check for her for pituitary hormones, and for sure I need to do LH and FSH and ultrasound ovaries for the PCO, and I need to do autoimmune hepatitis screening, ANA, SMA, liver kidney microsomal antibody, and soluble liver kidney antigen. Okay, okay. For sure, I will refer her to the OB-GYN because they are more. How can we ask about panhypopituitarism, Sheehan syndrome? Okay, so panhypopituitarism. Okay, doctor, I will just answer you. So now the case is wrapped, and you know how to examine a case of amenorrhea. Very easy. If this is a secondary amenorrhea, if there is a secondary amenorrhea, then ask about, examine the thyroid, examine the visual field and the tummy. Okay, so the question here, how can we ask about panhypopituitarism and Sheehan syndrome? So in the Sheehan syndrome, ask her, she told you that her pregnancy was normal. It was okay, nothing. So it was uneventful, no bleeding, no severe bleeding that led to hospital admission. And there is one case, if you attended the course, the clinical course in Egypt, there is one case like this. She was a Sheehan syndrome and she had panhypopituitarism. Okay, and when you say it once, you will not forget it here again, inshallah. So you can ask her about any associated, ask her about manifestations of hypopituitarism, hypothyroidism, and hypoadrenalism. These are the manifestations of panhypopituitarism. So again, from hypoadrenalism, do you feel that you become dizzy when you stand up from sitting position? No, I don't feel like this. Look at her hands and offer to look at her nipples and areola. You will find it white. I mean, not hyperpigmented, because in Addison, things are hyperpigmented. Okay, but here it's not hyperpigmented. So if you look at her crease, you will hardly see her hand crease. And if you offer to look at her area, it will not be pigmented. Okay, then ask about manifestations of hypothyroidism. Okay, so bleeding in postpartum and history blood. Yes, what is the LDD, doctor? I cannot understand what's LDD. Can you please write what's LDD, because I have to go the prayer time here. Okay, doctor. I hope everything is clear. If you have any question, just post it on WhatsApp group. I need your feedback, doctors. I'm not sure if I'm talking very rapidly or I am last rate of delivery. Okay, or I am talking slowly. Thank you so much, doctors. Please, please, please don't forget to write everything, because entering station 2 or station 4. Here, I am giving you also time, 4 minutes, 2 minutes to prepare, to write these things before starting the station. Nice to meet you today. We may meet soon, inshallah. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Amanaz.
Thank you, Dr. Khalid. Thank you very much.